The interesting thing is that the actual pain signal in our body is the slowest nerve message out of all the different messages that your nerves could send to your brain. What were you doing in the workout?
So yesterday I did seated rows, which were really good. I made my own modification with towels to do back squats.
Okay.
So I'd wrap 2 towels around the bar and do like a safety squat.
Okay, okay.
You know, so I don't have to get my arm behind the bar. So that was
Okay.
really nice.
Okay.
I did just some push-ups, really easy, triceps, all that. And it felt really good.
Okay.
Kept it light, kept it easy.
Okay.
I say the only major thing that happened yesterday, actually, this couple came up here.
Okay.
And they went to the wrong place, so I walked them over there and I opened the door for them, walked them inside. As I was going in, I held the door open for the lady. And I mean, just the pressure of the door, when I was like in maybe like this position right here, like so, and the door like closed on my arm and it like hurt pretty bad.
Okay. Okay. So if you showed me with like this door.
I walked in and it was a door with an
Like it's
arm
gonna
on it.
keep
Yeah,
it-
so it was
yeah.
closing on its own, right?
Gotcha.
So I walked in, and I would say it was probably, and the door swung the other way, so I'm gonna use my left hand.
Okay, okay.
But so I was like this, and I went to open it for her, like this motion right here. So I was pushing back and away.
Okay.
And it was like
In the front.
yes,
Okay.
one of those things. But it was just an instance, and then I actually came in and like I tried that motion again, and if I did everything right, it was fine. But like in that moment, like it
Yeah.
hurt pretty bad.
Yeah.
So that happened.
I want to try poking on something real
Okay.
quick. I'm going to poke on your external rotators here. Okay, so if you remember when we very first started working together, we first cleared this up, right? And this helped a lot, right? But we haven't worked on this in a while, right?
Okay.
Came back here and like poked on it or worked on it. And sometimes what can happen, what I was thinking when you mentioned that like you're still avoiding like this, what I'm thinking is that sometimes when these muscles are really tight, they can kind of shove the humeral head forward, especially as you're in this position. If you're really tight here, it'll kind of like push that humeral head forward, which then causes a lot of like sharp pain, right? Or even in this direction, you're holding the door open, and if this is really tight and you can't like let that humeral head sit back, it's gonna shove forward and then can cause some pain. So I think today I definitely wanna spend a little bit of time, definitely during the manual part, working on this a little bit and see how much this helps this. Still work on that coracoid, process, because it seems like that's helping, but I think I want to readdress this.
Okay.
Now, exercise-wise, we did the external rotations again last time. Did you do that the other day?
I'm doing that just with a water bottle.
Just with a water bottle?
The only exercise I'm having an issue with is the crossover.
Okay.
And so I guess I can
Yeah.
show you real quick.
Yeah.
And even like that, if it feels fine, like now, again,
Right.
as long as I do everything right.
Okay.
So when I'm doing this guy, what I find is that I have to go out more.
You can't go up as much?
Yeah, and when I try to go up, no matter how hard I try to like get into position, like right there is still like
Here?
up.
Up here?
Yes,
Okay,
yes.
okay, Okay.
But now if I'm out,
Yeah, then it doesn't.
I'm okay.
Okay.
But if I'm up,
Yeah.
I like to try as hard as I can to, and that doesn't feel terrible. It feels
Right.
better than, but I'm like really focusing
And what are you
Trying.
thinking about focusing on? What are you telling yourself?
back here.
Back here.
Yeah, where
okay.
that my finger is right now, scooping that down under.
Okay.
Yeah,
Okay.
is like what I'm really.
Any type of? Are you thinking of retracting it all?
Yeah, that as
little
well. Yeah,
bit?
same
Okay,
time.
okay.
Yeah. And like I'll try like, I mean,
Yeah.
that doesn't feel terrible.
And is
but,
it worse on the way back or on the way down?
Oh, good question. I see right there. I'm feeling it.
And then as you start to come down,
And I keep pushing it, it's getting worse.
Okay.
And then when I come back, it's just like the further it goes, the worse it gets.
Okay, so no issue with coming back.
No, it relieves in the same fashion that it came on.
Okay.
Yeah.
So the further you move away from that position, the better you
That's
feel.
correct,
Okay.
yes.
But it's not like a recoil reaction of like as soon as I started moving back into neutral, it felt almost like a sharp pain really
No.
quick because I was moving back.
No.
Okay. All right. Good. I want to start with doing some work on the external rotators, some manual work on
Okay.
there. And then I want to retest these things. I want to retest this. I want to retest this that you're
Okay.
doing right now and see if that helps any.
Okay.
And if it does, great. We can make sure to even do some taping for that back there,
Okay.
right? But let's go ahead. Let's do that first and see how your body reacts to that.
Okay.
Okay.
Sounds good.
Test. If you
Okay.
sat up and you tried to like rotate that shoulder out, like you were gonna squat with your arms out.
Oh, okay. So like
Just
here.
tell me like how that feels.
That, right?
Yeah.
Yeah. But I mean, I can, if I just go real slow, I mean, I can get there. And there's no,
Yeah.
I wouldn't call this pain.
Right, right. Would you say that it is any less pain getting to there or any easier getting to there after working on those muscles, or do you feel like it's about the same?
I'd say it's better.
A little bit? Okay.
Probably not enough where I'd feel comfortable trying to do it.
Sure, sure.
I'd be very like I would be scared of like getting stuck.
Yeah,
you
yeah.
know?
But maybe it's the beginnings of like I feel how that could help
Right.
if we did it and kept working on it.
Yeah, I think so.
Okay.
Yeah, I think
well,
so.
let's still do a little work on here, and then
Okay.
we'll try and retest again
Okay.
and see how it feels. Okay.
Okay.
So lay on your back for me,
Okay.
and we'll go ahead and take the tape off.
Okay.
Okay. Last time we spoke, we talked about, depending on how you felt after last time, would we go, the surgery route, right?
Right.
So, I told you that if you felt like it was better after last time, if you felt like, you weren't hurting as bad, you weren't as limited, you were heading in a good direction again, that we wouldn't consider that. We would just, apply ourselves to the things that you're lacking.
Right.
So what are your feelings on how you're feeling?
I mean, I feel much better.
Okay,
Yeah,
okay.
especially this. And actually, I talked to Mike the other day too about it, because he's dealt with different surgeries and stuff too. And
Okay.
it's like, wait as long as you can.
Don't agree to get cut on.
Yeah. So I mean, I'm willing to give this till the end of the year.
Okay. Yeah. I think that's plenty of time. I mean, if you're not better by then yeah.
Yeah.
I think that's plenty of time.
Yeah.
Is this an area that hurts sometimes or not really?
I would say this is pretty close to like where I would feel like a sharp pain, but it's definitely more over compared to where I would usually feel it.
Understood.
For sure.
Understood. Because your nerves are instead focused on the fact that there's pressure, which is a totally different signal and a different nerve type that sends that signal to your brain. The interesting thing is that the actual pain signal in our body is the slowest nerve message out of all the different messages that your nerves could send to your brain.
Is there a reason? Do you know?
No, I mean, reasoning, I don't know why.
Like
All I can
physiology? Like what is the reasoning?
Well, I'm sure that you could go into the fact of like looking at like, okay, which of the nerves are more myelinated, have more insulation basically that then can send the messages faster, or which of the nerves are getting better nutrients, or which of the nerves are larger. But the type of nerve that carries your pain signal is a C type nerve, and like I said, if you're getting stuck with like a sharp object, or if you're having pressure, or if there's heat or cold, all of those signals make it to your brain faster than pain. So that's kind of like, you know how when you get hurt sometimes, and let's say you scraped your elbow, right? You like immediately grab it and you like hold on to it. Subconsciously, you're applying pressure and it decreases your pain because you got there and you applied pressure before the pain got to your brain.
Oh, yeah, I understand.
better?
Yeah, when I first started, but I wasn't like in a good
You
position
set,
either.
yeah, I saw you set.
Yeah.
Does it feel easier? Okay.
No, yeah, I mean,
So what I'm gonna do now is we're gonna tape both
Okay.
this, and then we'll try again and see if it's even easier.
yeah.
Okay.
Something I have noticed now that you were mentioning earlier, I don't know why I didn't think about it, but you were talking about coming out of it.
Yeah.
If, say, I was in this position,
Yes.
and I even noticed this, like, for example, in the putting something up in the pantry, like putting a plate up or something. I have noticed that coming back down, like I'll let the plate, when I'm picking, I have the plate in my hand, right?
Right.
Putting it up in the pantry, being very cautious.
Right.
But then when I let go and I come back down, if I'm not super careful,
About how you're doing it.
yes, that will like give me one of those sharp pains.
Okay.
But what I'm doing now is probably not the best. Is what I'll do.
Yeah.
This looks really funny, but like I'll do something and then I'll just be like, you know, just because like it's scary. You know, I'm just like constantly worried
Right.
about it.
Have you
know,
thought about like retracting and then like bending your elbow so you can like bring that lever arm in?
that works as well.
Okay.
Yeah, like I said, usually what I do is just like this weird little.
Yeah.
You know, like
well, and I don't
movement
want it
thing.
to turn into like, because I'm doing this and then I do this, like now I've got like mid back pain,
Ah,
you know, like
yeah.
because I'm rotating every time. So probably the safer thing to do would be like, would be retract and then bend that elbow so you decrease that lever arm and then go ahead and bring
then
it down.
lower.
Yeah.
Yeah.
Okay, so now we'll retest again. I'm gonna
Okay.
have you try the external rotation. Tell me if it feels any different.
Feels
Looks
pretty
like
good.
you're going further. Looks like you're going significantly further.
I feel a small pinch, like in the low, like if you the bottom of your shoulder blade, you know.
Okay, so like down.
I mean, it doesn't hurt.
Here?
Yeah.
Okay, okay.
Just like a pinch there.
Okay, okay.
But other than that, I would say that's the only. You know, everything feels pretty
Everything
good.
feels better. Okay,
Coming
good.
back also.
Good,
so.
good. Okay, but yes, your range of motion looked significantly better after we finished the tape, after we did that manual work, okay?
Okay.
A long time ago, I gave you the stretch to reach across and stretch in that doorway. You remember that one? Like you pulled here and you lean away and then you turn. Do you remember that one to stretch
I've
all
done
this?
it before.
So have we been doing that lately?
No.
Okay. If you did it right now, do you feel a stretch at all in that area? Yeah?
A little lower.
A little lower?
Back here.
Okay, good. So I want you to add that back in.
Okay.
Because again, if the theory is that the tension back here is pushing that humeral head forward, then we need to stretch that out back there so that your humeral head can sit back in there, okay? With the Y, what I want you thinking about is shoulder depression, right? So we're bringing it in and then elevating, but we are not elevating while like reaching towards Caitlin, right?
Okay.
We're keeping the shoulder blades down and then lifting. You should feel the work right in like the lower part where you said you were feeling that pinching. That's where you should feel the work for it.
Okay.
So I just want to see how your form would look with it, and if it does cause any pain.
Okay, so here.
And then we drop first, and then we use this. Good. So we don't want to feel any kind of pinching here if we can, which means you may not be able to go up very high.
Yeah, I mean, I feel it in
the
area that you talked about, the lower.
This area?
Yes.
Okay, I'm gonna tell you when you start to pinch though, okay, ready? And right there. That's when you're starting to elevate here. So you wanna think, yep, there you go. And then you could lift more, yeah, there. That's probably the most that you can go.
That's
Yeah.
about it.
You might think about like almost like getting some thoracic extension with it,
Uh-huh,
right?
I am still doing that one against the wall.
Good.
I think it's just like knowing the limitation of how far to go.
Sure. I agree. And so, but you can feel when it starts to turn on, so you can tell yourself when to stop, right?
Yeah, I think I feel the pain as much as...
Pain in the front?
Yeah, in the front of the shoulder.
It starts to hurt after doing so many?
No, like every time you said it felt like it went up.
Ah, then you feel the pain.
I don't feel the raise that you're talking about, but I feel the pain in the shoulder.
Okay,
Right.
so that's your cue. Gotcha, gotcha. Now, as you're getting more tired, I'm gonna show you on this arm. As you're getting more tired, what it's turning into is rather than this, you're starting to do like, kind of like the D2. You're starting to bring it out. So make sure that it is a this move, not a this move, because this could lead to this, right? And we don't want that. Here, it's not gonna roll forward, right? So you're more protected there. Does that make sense? Good. Good. So what do you think about this exercise?
Yep, I could do these.
Do you feel like this is more tolerable than the one on your back?
The reach across? Yes.
Okay.
Yeah.
So let's replace the reach across with this one.
Okay.
Like I said, I normally don't give these to people because I feel like most people can't figure out how to like do it properly. They always reach forward and they get really tight in here. But you're really aware of your body and how exercises should feel and look. So I'm okay with you doing it.
Okay.
Okay.
If I go out,
Then you don't feel it.
feels fine.
Yeah.
If I'm up, it doesn't feel, it feels way better.
Okay, good.
But at the very end there,
Still a little bit.
yeah, the front of the
Okay.
shoulder.
Okay. Gotcha.
Again, yeah, if I go out, which I don't know if I should continue just to do that.
I wouldn't go out, no.
Okay.
I wouldn't go out because one, when you go out, one thing that can happen is that this might end up like kind of going forward like that versus when you're up, it's less likely to do that, right? And two, the reason I gave you this one was to be able to help you with overhead type reaching. So if you're not able to do it, you have to do it out to the side, then it's not really meeting the goal. Right. So today we did the manual work on your external rotators, so that way they won't be tight and pushing your humeral head forward. We worked on your coracobrachialis right here because you were having some tension there as well that was causing you some pain as you're lowering down. We retested after every single time, and you did get better and better and better. Then we added the tape to turn on the muscles back here, turn off the muscles here in the front, and that got you significantly more range of motion, which was great. So I'm gonna have you keep working on stretching out the muscles in the back by doing that posterior scap muscle stretch. I'm gonna have you keep working on improving your lower trap strength by doing those Ys that we added, okay? And making sure that your upper trap isn't kicking in. And then keep working on the external rotation strengthening so that way you feel comfortable with going into that position for the squatting in the future, okay?
Got it.
Good.
Awesome.
Good.
Thank you.
You're welcome.